Our medications are so much better and so much easier for patients to take. The vast majority of patients can successfully treat their HIV. This puts us in a whole new era where we have patients living with essentially a virtually normal life expectancy prognosis with well-treated HIV over the long run. We worry about HIV itself being a risk factor for cardiovascular disease. Smoking on top of that even increases the risk further. And we're always thinking of modifiable risk factors, things we can treat like diabetes, high blood pressure. Quitting smoking is one of those modifiable risk factors. So it's probably the most important one that we can modify if we can help a patient quit. Smokers on average, I've heard different statistics, but on average it takes about 10 years off of someone's life expectancy. So if you add that on to someone with HIV, we're working hard to keep someone healthy and living a normal lifespan, and then you're taking 10 or more years away. So that's one reason why, especially if someone is younger, it's important to try and get them to quit smoking. The less total years they're smoking, the better chances in the long run of having a normal life expectancy. If you add up the cost of a pack of cigarettes a day, every day for a month and a year and 2 years, that's a significant chunk of change that people ultimately could be saving. Most people, I've talked to patients who've quit, they've been able to actually save money every day. It's a little bit over time, so you may not see it, but as it adds on, it's a few $1,000s a year, more or less, depending on how much someone's smoking. So having a quit coach or quit help via the quit line is extremely important. I do encourage patients, if they have access to this resource, which our Care Assist clients do, to take advantage of it. A lot of my patients say, oh, I already know all this, I don't need someone to tell me things. But I've had more than one patient down the road tell me, it actually did help having someone to call or having them call me on a scheduled basis, because there are those moments where you just kind of mentally have troubles, not picking up that cigarette. Smoking and its long-term effects, they're extra important in people with HIV, so it's an extra important issue to really work on. So I would say don't give up, keep trying, access what resources you can. Again, the Oregon Quit Line, some of the programs and medications and counseling out there. If it doesn't work the first or second or third time around, try again when you're ready. Definitely give it another try. There's no wrong time to try and quit smoking. I would never say it's too late to quit smoking. Even if you've been a heavy smoker for a long time, there's definite benefits to be gained. So as hard of an issue as it is to tackle, don't give up and give it a try.
You've taken control of your HIV. Now it's time to tackle smoking. Care Assist clients can call the Quit Line for free support and cessation medication. Call 1-800-QUIT-NOW or talk with your doctor today for more information.